everybody. This is Jaemin Park with the Heal Venture Lab. We're doing our Heal Venture Lab podcast. Here we have Dr. Vas Metupalle, who I've known for many years and who's been really like a part of the Singapore ecosystem. I know he's days doing the MyDoc. So I guess he's now in Dubai. Also now we're going into another company called the Reso Health. So
Correct.
I'll let Dr. Vas introduce himself and yeah. So Vas, good seeing you. Yeah, it's been a
Yeah, nice to
yes,
see
yes,
you. Yeah.
yes, yes. And
Really appreciate your introduction and time. Yeah.
I know, thank you, thank you. I think we have a lot to learn from you. I mean, especially you've been in the Singapore ecosystem since pre-COVID. I remember pre-COVID,
Yeah.
you were with MyDoc at the time.
Yeah.
You're also a medical doctor, so you've also seen the I guess the clinical side in the Singapore and
Right.
now
Yeah.
you're in the Middle East. So I think we have a lot to learn from that, and also what's going on in the Dubai now.
Yeah.
Like what's going on in the medical tourism that you're looking at now, and I think, and then after that you
Right.
can go about like the Reso Health. So yeah,
Yeah.
thank you. Yeah,
Sure.
please start. Yeah.
Okay. I'll do a quick intro. So I'm a medical doctor trained in the UK at King's College in London. I'm Singaporean citizen. I've been in the space of first clinical medicine, working in Singapore General Hospital for 3 years in 2005, 2008. Then I became an entrepreneur. I ended up from 2008, I was one of the first to do the radiology
Yes.
image sharing and then reporting for satellite X-ray centers. I was helping primary care groups like Healthway Medical Group set up and operate diagnostic centers. And then I went up to set up my own telemedicine company with my co-founder at that stage, and two of us from clinical background. And Singapore, it was the first time someone was doing telemedicine openly at that time, 2012. It was very challenging first few years, trying to get even acceptance by your own community, acceptance by Ministry of Health, acceptance by industry like pharma and pharmacy chain like Guardian in 2014. And then going live to insurance companies, starting with few the early adopters like Aetna, Cigna, and then larger ones like Prudential. So it was a journey, and then others came in. So we have other telemedicine companies also. So it was a good ecosystem in Singapore. Uh, Happy that we were one of the early guys, but then it became very big in Singapore, became the hub with multiple telemedicine companies from Mana Doctor to Doctor Anywhere to others. Uh, and 2017 onwards, we had a Sandbox. So Sandbox was good also for Singapore in terms of learning that we were ready for COVID. So because of all that preparation of Sandbox, by the time COVID hit, the country was ready. We could manage people at home. Uh, they didn't have to come to A&E. We had that first wave when it hit was with the workers and the workers' dormitories, and we managed to manage that with the telemedicine services. So they didn't have to go to a hospital, and we gave the medicine to the home. The second big wave, when it happened in 21 September, um, for the general population, we were able to do something like 5,000 people on telemedicine a day. Uh, and that was very good for the country. We managed to reduce the A&E visits. So I think telemedicine got proven at that stage, and now it's mainstream because of that, right? Uh, I managed to eventually move on to preventive health and now longevity space. I moved to Dubai 2 years ago,
Mm.
and I've been exploring cross-border medical tourism plus preventive wellness and longevity. So that's really what's the background and what's been going on. So yeah, happy to
Okay.
be here today and take on whatever to explain how things are going here.
Sure, sure. Thank you. Yeah, I mean, I've known you since I've heard about your company since the medical school days.
Yeah,
So, I mean, you guys were there like really
yeah,
early. I mean, way before anybody in Singapore thought about telehealth. And
yeah.
I mean, for sure, I think it's partly because of people like you who have kind of a pioneered this area. That when the COVID hit, really, I mean, Singapore definitely was in a much better position than other countries in terms of I guess like dealing with like COVID and providing remote help because I mean of course it
No,
was one
but
thing that
interrupt a bit, like it is
uh,
not, of course, the startups alone. The government was doing
oh,
a very good job with the Sandbox
of
by
course
2017,
yes
2018, and especially MOH. There was Dr. Raymond, who led the Sandbox, and now he's the head of HSA. So I would say he
oh,
was
okay.
the instrumental in getting a lot of these things ready. Without that, we
Ah,
wouldn't be ready as much. Yeah.
they'll make a really good episode. I'll see if I can request a podcast interview.
Yeah, yeah, you should ask him. He was he's very, now he's doing a lot more things in HSA. So
Yeah.
yeah, yeah,
Okay. Yeah, so so I think I've heard about him of course. So definitely. I think we can have a one episode on telehealth alone on the COVID. Yeah. But definitely I think you and Snehal and others who were really like at this health tech innovation early stage really kind of inspired a lot of people to kind of think and do the same. I know a lot of some of the players that came after you I'm sure they all got partly inspired because people like you are really like, pioneering this.
Oh,
Of course, with
we were doing it together in 2017 onwards. The Sandbox was a very good learning curve between us. All these companies that came in, from Speed Doc to Mana Doctor to Doctor Care Anywhere, Doctor Anywhere,
yeah,
sorry, Doctor Care Anywhere is a UK company.
mm,
So in a way, we managed to come up with a course that other doctors could also have with telemedicine. So the Sandbox was where we came up with all the learning to come up with the course. So now everybody gets a course linked to SGH or Sing Health, and they have to pass that, and then they can do telemedicine safely. Yeah, in Singapore, yes.
that's something that I think a lot of the neighboring countries still do not have. I
No,
can share from my
the other
experience.
countries like Indonesia really caught up, right? Like
Okay,
Halodoc, and
okay,
we were aware of them. We were in touch with Jonathan from Halodoc in Indonesia. In
mm,
Malaysia, we had another doctor anywhere, Doctor Care, which is led by Muniandi, I think, and it was good. So it was a nice regional thing. We kept learning from each other, but sharing from Singapore out as well as much as we can. So this
yeah,
COVID, I think Southeast Asia, in a way, was more ready than
yes, yes,
some other
yes,
countries.
yes,
I think that was a good thing. Yeah.
yeah. Good. So yeah, I'm glad to hear about. I mean, now you kind of put things in perspective. I mean, and also you're humble to give respect back to the government, which is
No, no, no.
but of course, Singapore government
It is
definitely.
definitely them.
Yeah, that's
Yeah.
very humble. But okay, it's good. Hey, so maybe before we go into the medical tourism, I mean, just out of personal curiosity, what got you into the I mean, what made you jump into the startup, the doctor, MyDoc? Like, well, how did it come about? I mean, because actually a lot of us know about MyDoc, but we still don't know how it came about. Yeah. So
It was definitely a very in-depth kind of discussion between me and my co-founder.
Mm,
For over 10 months, we were discussing back and forth on our learnings because I was an entrepreneur in Singapore already for 4 years with teleradiology. And he was someone from the US, and he had a lot of information and understanding of the ecosystem in the US.
mm,
And so it was an exchange of ideas. It was really a in-depth exchange of understanding what is the roadmap, what is the potential, what is the problem statements. Uh, we were kind of very sure that this was the way forward, but we underestimated, of course, as any founders, on the challenge of convincing others, especially in the medical fraternity. So it was a very tough first 3 years of
mm.
getting that going. But because we stuck to it, I think we were kind of prepared to invest ourselves first. So the first 2 years we did it ourselves, right? And I think all that was how we started.
Okay. Yeah, I mean, you're definitely also an early pioneer in terms of being an entrepreneur. I mean, because nowadays a lot of people invest in startups, and there's a lot of like events and support systems.
Mm.
But back, I guess this was what year was this when you first started?
2012. But to be fair, 2012, we were already getting support. Spring
Okay.
Singapore was doing the startup investments, and they
Okay.
were one of the first to invest in us. And NTU also had the Intuitive. So we were
Mm,
one of the first Intuitive guys, part of that ecosystem. Yeah.
okay. Okay. Yeah, I think maybe we do one episode just on the like your early and
No, no problem, no problem. Yeah,
that'll be actually
I
quite
think
interesting.
you
Yeah.
should you can definitely get a lot of this is all something that's out there already, right? So yeah.
Yes, yes. Hey, so yeah, so that's good to hear just kind of how you first started. And also like just kind of like how the early ecosystem was like. Now that you have gone to Dubai, right? I'm also very curious, what kind of things do you see on the ground right now? Yeah.
Yeah. Actually, to be fair, Dubai, it's not new to me.
Okay.
I've been coming here every year from
Mm.
2008
Oh,
for
wow.
Arab
Okay.
Health or in
Oh, okay.
January every year.
Mm.
And the first time I came, I was given an immediate opportunity to set up a teleradiology system between
Mm.
Abu Dhabi and Singapore for second opinion of MRI scans. So
Mm.
I set it up in 2008. Very few people actually know that, but it was very progressive place that people were open to ideas. So I saw that as a good way to learn from the crossroads, because like in Arab Health every year you get a
Mm.
crossroads of East and West. You have American, you have Chinese, you have Indian, all kinds of innovations being shown.
Mm.
And it's one of the largest healthcare conferences globally.
Mm.
Um, and it only grew every year. So I never missed it for the last 17 years,
Mm.
except 1 year in COVID. It was the 2021 when I missed it. But
Mm.
otherwise, yeah. So that's how I kept in touch with the ecosystem and people here. And two
Mm.
years ago, it became a natural kind of when I was looking at going overseas, I saw this as a natural opportunity.
Mm.
Uh, Also, after COVID, somehow I felt Dubai had surpassed in terms
Mm.
of some things in
Mm.
innovation,
Mm.
including AI.
Yeah.
The investments they were making, it was huge in terms of billions of dollars
Yeah.
in AI and infrastructure. So that opportunity plus a consulting group that was open to having me here.
Mm.
So I joined them to look at healthcare consulting
Mm.
opportunities. That
Mm.
became easy inroad for me to understand the region So they were in all 6 countries. So I was
Mm,
traveling between Kuwait, Saudi, Qatar,
mm,
Oman. So we got to know the region. There's a consulting group called AJMS,
mm,
and they're quite strong locally, regionally.
mm.
So that was good for me to move and learn about this region even more. Yeah.
Yeah, so it seems like you already had one foot, in the Middle East. I mean, not everybody
Yeah.
from Singapore has that kind of reach, so which is good. So I guess definitely Middle East has seen more, I guess, increase in healthcare. Now also a lot of medical tourism. Uh, Also, I think in terms of funding, yes, I do also hear that sometimes, like us in Singapore, we kind of see Middle East as like a new destination for capital, but also like a lot of entrepreneurs going there. What do you think? How do you think they're like doing that and
Yeah.
being able to compete with Singapore? Yeah.
So a lot of the inspiration came from Singapore. They are
Mm,
very open about it.
mm,
The government here in Dubai has been the most open about how they model Singapore for
mm,
both the airport, port, a lot of new things in the early 2000.
mm.
And the reason I felt they surpassed was because of the opening up during COVID. I think the
Yeah.
reopening of COVID, they were
Mm,
more open. A lot of foreigners from Singapore left Singapore
okay.
or they were not allowed in during COVID, towards the end
Mm,
of COVID. But they
okay.
were very welcome in Dubai. So I still see a lot of ex-Singaporean expats
Mm,
who are now living in Dubai, right?
oh.
And they were like, they didn't want to go back to Europe, but they ended up stopping over in Dubai. So a lot of them are working in insurance, banking, a lot of them, and they're not going back now.
Wow.
They are staying here, which is a nice ecosystem of ex-Singaporean stroke Hong Kong people who are based here. Uh, so I think very similar kind of dynamics where
Mm,
they were welcoming people
mm, mm.
as foreigners,
Yeah.
and then they invested in the infrastructure,
Mm,
they invested in the technology, and they don't get in the way. The other thing is they don't get in the way of putting extra regulations and things like that.
mm.
They're much more open.
Yeah.
Of course, there's also the tax.
Mm.
Personal tax is still zero,
Mm.
which is
Oh,
huge
yeah.
for any entrepreneurs. And it's kind of a good step forward for even investors, because when you talk about angel investors, if they want to
Mm.
base themselves here,
Mm.
at least they again, not just the tax, but it was a very secure place. Even now, even with all these issues, it's pretty secure. The whole ecosystem came together here in the last 3 years that I felt
Yeah.
has become better than many other places right now. Yeah.
That alone is another episode. Hey,
Yeah.
yeah, I definitely.
I can invite the consulting group to explain that a bit more.
I
Yeah.
think we can go deeper. I like to go deeper on that sometime as well. Hey, so going to the now focusing specifically on healthcare, right? Uh, the thing is, there's a lot of Middle East patients that are still traveling to Asia for medical tourism, like Thailand, Malaysia, etc. But then, I mean, the way it sounds like the Dubai and Abu Dhabi and all these Middle Eastern countries also have like a very robust healthcare. So
Yeah.
why do you think there's still a medical tourism flow? Because we don't
Hey,
see much. It's like a Southeast Asian, like Singaporean, patients don't normally go to Middle East for care, but normally they come from Middle East to Singapore or Southeast Asia, right? What do you think is what are some of the drivers for that? Yeah.
see, it's actually a very deep topic,
Okay.
and this is good that you are interested to know more about this. I've been watching this space every Arab Health, as I mentioned, from 2008. So,
Mm,
so what you see today in Dubai or UAE didn't start just recently or just after COVID. It started in 2012 when I think there were a lot of uh, hospital chains from overseas looking at setting up facilities. And the Dubai Healthcare City, which was a special economic zone that was set up. Uh, that was really a eye-opener for
mm,
most people. A lot of things could be done there that couldn't be done in many other places. So it became a special economic zone where you can do stem cells and you can do foreign doctors can register and practice. Uh, Again, with doctors coming over here, foreign doctors with less tax or no tax. When it comes to UK or US doctors, it was a huge thing. No, they say suddenly 30-40% what they were paying for tax is no longer being paid, right? So they saw the quality of life better. So as the brand started building, King's College Hospital in Dubai, Cleveland Clinic in Abu Dhabi, there was Mayo before and now taken over by local group in Abu Dhabi as well. So in a way, the brands came, the doctors came, so patients will follow, right? And so
mm,
the regional patients started coming into Dubai for advanced therapies. They don't
mm,
need to travel to UK or US, which they used to. They're all covered for healthcare. So they
mm,
were going to US for anything like a simple operation or simple, cancer for sure, they're still going. But most other operations, they don't need to go anymore. They
mm,
can do it here. The only thing they will look outside, out of pocket payments, those like aesthetics, plastic surgery, hair transplant, these
mm,
things they will go to other countries like
mm,
Turkey or Thailand or Malaysia.
mm,
So these are where they see is affordable places for out of pocket payments. But those
mm.
that they're covered fully for insurance, they'll
Yeah.
just do it within their country because
Mm,
now you have good hospitals and good doctors based here, right? And same thing is now happening in Saudi. So huge wave of hospitals are setting up in Saudi. Last year I was there for a conference and over $10 billion of hospital investments were going in just last year
mm.
for the 2030 vision. So I see a huge, similar kind of roadmap in Saudi as well. So most things they will not travel anymore. They don't need to go to the US or Europe for treatment as much. Yeah.
So, like Thailand, for instance, I mean, traditionally they've been doing a lot of aesthetics, dental, kind of rejuvenation, kind of medical
Yeah.
tourism, wellness. But then
Yeah.
now, if you see some of those guys, they're really having like more advanced surgical care, like
Yeah.
vascular surgery. So, like,
But
I mean, so
I,
they're doing that, but then I'm just wondering, how are they going to attract
yeah,
Middle Eastern patients there
yeah.
if Middle
They're
East
not
already have, yeah.
they're not going to attract advanced surgical patients from developed parts of Middle East because
Mm,
of the insurance network that is
mm,
strong within the developed part of the six GCC countries. It's
mm,
quite tough to move them for. In the past, they could,
mm,
but I think now it's with all the facilities in the region, it's hard for insurance companies to send patients out.
mm,
They most likely will get treated locally.
mm.
But there are other parts of Middle East that's opening up, right? Iraq, for example, a lot of Iraq
Yeah,
patients are going to India
yeah,
for medical tourism. They can go to Thailand as well.
mm,
And that's 50 million people, right,
yeah,
in Iraq compared to just 50 million people all of GCC. So in a way, it's a huge market as well and its oil economy as well and doing well. So there are opportunities in Middle East beyond GCC. And the
mm,
GCC, the six countries, are a good base for medical travel in terms of aesthetics and as I mentioned, plastic surgery, hair transplants, and things like that, dental. So it's still an opportunity.
mm,
And Thailand is doing very well when it comes to Phuket and Bangkok, when it comes to opportunities in these areas. And it will only grow with the stem cells and other therapies, regenerative therapies as well. Not all are going to be surgical, right? To recover, rehab, detox, these are things that are still opportunity for Thailand when it comes to GCC. Yeah.
so the days of which patients going to, let's say, Singapore or Malaysia for like advanced care will be probably less and less
No,
moving.
Singapore by design, right?
Yeah.
Singapore, 2008, I think I was already part of a medical travel company for a while, helping patients into Singapore. And then there was 2011 onwards, the government was very clear. They didn't want to support that because during the early years, like we had a department in each public hospital that was catering for foreign patients.
Mm,
And most of that has been downscaled because we just don't have enough beds. We have 11,000 beds or something at that time. I'm not sure now, probably more.
mm,
And so we don't have the capacity to treat foreign patients that much. What used to be 70% foreign patient in private hospitals has
mm,
now become less. I heard it's 50-50 or
mm,
or less. So even private hospitals are less foreigners going to Singapore,
mm,
residents in Singapore, and that would fill the hospitals. Um, you know, so the other places like Malaysia
mm,
is where everybody went instead of Singapore because the same groups were building hospitals like Parkway Pantai to Regency Hospital to Makota Medical. So you have a lot of Singapore-linked groups with hospitals in Malaysia. And many of the doctors there got trained in Singapore as well and went back and practiced. And very similar UK-based education and protocols.
mm,
I feel comfortable even going to Malaysia for treatment as well. Like personally, like
mm.
it's good value as well. And so yeah, I think Malaysia is the one that benefited from 2012 with the Singapore's policies to reduce the need for medical travel, right? So then Malaysia really boomed from like 50,000 medical travelers to like 1 million medical travelers a year. So it's like huge increase during that 10 years till COVID. Post-COVID, I think there is recovery and there's like Penang Adventist I went to visit after COVID. They were getting a lot of new things. And so there are a lot of good facilities
Mm,
out in Malaysia. So that will be the hub, I think. In terms of Thailand, I'm not as aware of some of the large facilities other than
mm.
Bumbungrat, and I've been
Yeah.
to a couple. The kind of widespread quality hospitals with doctors, especially trained doctors in different countries working. I think that's where medical tourism needs that kind of lot of doctors with good training. The That's where the credibility kicks in,
Mm,
so as long as they allow foreign doctors to work, then maybe yes, that's going to be a big part in the future for some of the projects that even Indonesia is doing because they are going to allow foreign doctors to work in SEZs
mm.
like in Bali,
Yeah.
Sanur SEZ, now Kura Kura has a SEZ
Yeah. Yeah.
in Bali. So those are how you can start that medical travel credibility, I think. Yeah.
But so yeah, so I'm aware of the SEZ with the Kura Kura Valley and I think a few Singapore doctors are already there, right?
Yeah, yeah.
The idea
Sanur.
is
So
to
in
keep the
Sanur,
yeah.
it's already working, right? Like there's a hospital there, international hospital there already.
Mm.
And yeah, that's right.
So you think this is something that other countries also should do, like Thailand,
Yes,
Malaysia?
they should allow foreign doctors, very well established foreign doctors, to register and practice. It's too much of a protectionism by local doctors
Yeah.
doesn't help the country when it comes to medical travel. Yeah.
Okay. So let's say like top KOL comes to Malaysia and let's say like okay, maybe some like really global KOL. Then but the thing is, you said earlier that Middle Eastern patients already have like access to top surgical care, right? So they probably don't even need to travel. So then what kind of medical tourists can you attract with that kind of top
So you're
KOLs?
talking about only 35 million people in GCC, but
Mm,
if you look at Southeast Asia, it's 600 million people, and
yeah.
then you have non-GCC Middle East is another 150 million people.
Mm,
So in a way, you got to widen your funnel
mm,
and work with the kind of niche markets that don't have these facilities or
mm,
don't have these doctors. These are the two things. You have to have good facilities, you have to have good doctors.
mm,
Then the programs are the same cancer programs, robotic orthopedic programs, or cardiology programs. So you got to create the programs and specializations and marketing and outreach. Those are the same for everybody. So you've got to know the niche markets and target those niche markets. Yeah, and then there's the VIP care. You got to be like there's a segment of that, and
mm.
and those that even India becomes a big target for that
Yeah,
because India has a lot of VIP kind of potential family offices
yeah.
in large metros like Mumbai or Bangalore and all that. They come here now sometimes. They used to go to Singapore,
Oh,
and now they're coming to Dubai for treatment, and they could go to Thailand for certain treatments as well, or Malaysia. So yes, the population is huge, just like how Chinese population is huge, and many of them come out for IVF therapies in Thailand. You can do
mm.
that for India as well, to have discrete services or private services. Yeah.
So basically, the non-GCC Middle East with the less developed healthcare could be an opportunity. But
Yep.
of course, each country should have, of course, top facilities and the top KOLs. But then, when I go to these countries like Thailand, like Malaysia, Vietnam, Philippines, even, when you talk to these guys, they always say they have the best doctors. So, I mean, how can you objectively I mean, I guess this has to be like a top global KOL kind of
Actually, it's not.
right?
It's not complicated. It's
Right.
actually not complicated.
Mm,
You know, uh, doctors get practice,
mm,
and it comes down to volumes,
mm,
right?
mm,
Uh, and peer reviews. If you go and ask doctors from around there, they will know about this specialist, right?
mm, mm.
They will tell you, right? So you can get feedback from peers in that country whether
Uh,
that doctor is good, right?
yes, yes, yes.
And this is the diligence that has to be done by the referral agents and
Mm,
the tourism coordinators. The
mm.
patients can't do that.
True,
They need to trust this middleman, and
mm,
the middleman should do the diligence.
true.
And yes, they should know that the hospital is clean, has the certification, like JCI or non-JCI is also fine as long as they have been there, they understand the workflows are working well, and
Yeah.
it's clean. Then the machines are there at latest, and the investments are secure. The hospital is not going to cut corners. And then the doctor's side, they have to understand if the doctors are well regarded, how many cases have they done,
Mm.
We're only going to focus on a few specialties, so it's not going to be that difficult to do diligence by these middlemen and referral agents. And then the hospital itself has to invest in the brand building, and so that's why they need to have the budget to do all this to if they really want to tap that market. Yeah.
Of course, inviting a foreign specialist to practice in your own country, there's a lot of a political pushback, right? Maybe Indonesia was able to do this, but if we suggest this to other neighboring countries, they're all probably going to have a problem. But I think, yes, I mean,
I think that again, you're underestimating the potential upside if they open up. So
yeah,
the government should understand the potential upside. It's going to be much more, and the pie is going to be bigger for everybody, rather than if you only allow doctors in your country to practice and you don't have enough such specialization,
mm,
you can only expect a certain amount of people. But if you want to widen it and you bring overseas doctors, one, credibility that you're having these overseas doctors, and two is the local doctors will also cross-learn from
yeah,
what
of
the
course.
practice or workflows are from overseas. The best thing Singapore did, I think not many people realize,
Mm,
is I think Professor Sukichi and a few others in Singapore General Hospital, when they were getting the specialist training program, they made sure that everybody goes overseas for 1 year at
yeah,
least
mm,
to train before they become a consultant. So everyone goes out to learn a subspecialty to UK, US, Japan, Korea, and then they come back. So,
yeah,
so the local doctors also got those training programs. I think that's not done enough in the rest of Southeast Asia. If you have enough of your own doctors, even if you don't want foreign doctors, get your own doctors to go overseas and train. Force them for at least a year or 2 years. Uh, if not, they can't become consultants, right? So then they will go and learn, and they'll come back. Yeah.
So I think that's good that Prof. Sukichi was able to really implement that as a kind of like a requirement because I mean, yeah, I don't see this happening in other countries. I mean, of course, people who are really motivated will do it, right? They will go to Harvard or wherever to like learn, but not everybody does that, right? So I think that is actually a very good, I think, suggestion for some of these countries to, yeah, really, I mean, look at of course, everybody has pride and their own political thing to worry about, but I think your insight really, I think that's, I think it would be really useful. Like, this is a speaking from how it works. Yeah.
Yeah.
Oh, so I want to also go a bit into the your new venture with the Reso Health, right?
Yeah.
So how's Reso Health positioned for the
Yeah.
I mean, what got you more into the medical tourism, and how is Reso Health positioned? Yeah.
Sure. So I did set up Reso Health with a company from Hong Kong, a
Mm,
listed company from Hong Kong called Peking University Resources Holding. We have done a joint venture and kind of set it up in Dubai.
mm,
It's a preventive wellness and longevity focused platform. We don't uh, focus on the serious illnesses that need tertiary care, and they need medical tourism for operations and so on. Ours is about looking after people to prevent them from getting into serious issues, right? So you have longevity and you have wellness centers. So there's quite a large wellness center in Dubai
mm,
uh, that was set up by an investors, and this was a 240 apartment facility with 60,000 square feet of wellness with Ayurveda, TCM, Western medicine, functional medicine unit with preventive kind of like biohacking units with red light therapy, hyperbaric chamber, cold hot baths, and a neuro gym which is for neuro balance kind of thing when it comes to specialized gym. So we had a very good opportunity to manage this, with me as a medical director there, and so I think that's really a good start for us. But now we're looking and partnering with other countries, locations. We have added Bangkok, we have added Bali, we
Mm,
have looking at multiple places where similar approach of preventive wellness and longevity can be expanded. And the interest is there. There are IV therapies people want. There's stem cells. They want to know whether they can get this done. Legally, stem cell therapy, regenerative therapies, there are few places where it's openly done, which is good to have regulations to follow the protocols, and Indonesia is one of the leaders in this. Of all places, Bali is a place where we work very closely with a hospital that has licensed stem cells therapies, especially for osteoarthritis. And similarly, in Thailand, there's a facility we work with in Bangkok. In Dubai, there's a stem cell at Dubai Healthcare City that we purchase from as well. So yeah, I think there's a path that I've taken, which is uh, into the longevity space, and Reso Health is growing in this and hopefully leading in this soon. We have launched a membership program, a bit like Amazon Prime, called Let's Go.Health, and with a simple membership program, we want to make it widely available. It's not exclusive, such that so expensive people can't enter this. Uh,
mm,
we want to make it affordable and more mass market for those who are looking at cross-border wellness and wellness tourism. Because I think
mm,
wellness tourism is a bigger market than just medical tourism. So
mm.
this is something we are working with the Bali side as well, and the government there hopefully supports. They are supportive, very supportive, and we will expand this there. Yeah.
So basically, your platform offers let's say if I'm a patient and I want to learn about different options, basically your platform provides that kind of insight.
Yeah. We have a couple of ways of bringing onboarding people.
Mm,
One is there's a BioAge questionnaire, which is all are evidence-based. I always
mm,
like to make sure there's evidence-based ways of managing chronic diseases or preventive. And there's BOTS, BORT is that evidence-based way of calculating BioAge using your lab results. So we have tied up with labs across the region, from Singapore to India to Dubai, on package that we created the package, such that it's a gold or platinum package. We do the screening, we get the BioAge calculated, and then we provide all the tools or ways to improve this BioAge, right? And we, of course, supplements are part of it. There's wellness services, biohacking services, uh, hyperbaric chamber, for example, proven in telomere lengths over a period of time. And there's quite a few other proven ones that we follow as well, right? And so we can do every 6 months, every year, we see the improvements of tracking. And so evidence-based tracking of and real-world studies, right? Everyone wants real-world studies. Well, we are ready to do this with a platform. It's not just going to a wellness center without tracking, right? We want to track, prove it that there are improvements being done, right? I mean, I'm an example myself. I lost 20 kilos. I've been feeling younger, 5 years younger since leaving Singapore, and right. So I think that's the way I see it. Yeah.
Hey. So, like the the patients or the customers will engage your platform, and it will have all these tools to help you kind of monitor and also kind of keep track, right? And of course,
Yeah.
you tie up with local, I guess, providers, and you have a
Yes.
network with these providers. So that, let's say, I want to do a hyperbaric therapy, then you'll know, okay, so you're in Bangkok,
Yeah.
so you go to this. You can provide that kind
Yes.
of insights.
We have to coordinate. So we have a care navigator, and the care navigator wellness coaches in most countries that we operate in will take over and manage that for you. Because as a member, you are able to enjoy these kind of concierge services in multiple countries under the platform, from Singapore to Malaysia to India to Dubai, Bali, Bangkok now. So Bangkok is actually, of course, going to be a very big hub for us. We are going to work on this with a local medical center called BU, and we have tied up closely with them on all these therapies, including double filtration plasmapheresis, which is very popular there. A lot of Chinese travelers are coming over for this treatment, and so we are learning as well as which is succeeding, which is not as effective, and we provide from experience of the local partners as well, right? So that they are good at something, we learn from that, and then we can teach the others in another market on how to do this as well. Yeah.
I mean, you engage with a lot of different providers across across countries. So you probably have
Yeah.
a very good understanding of each player, each provider, the strength in whatever respective
Yeah.
therapies. And also you can kind of tell what works and what doesn't.
Yeah. And we should track it, and we should give them feedback as well. So after each therapy, the customer has to give feedback, and we follow up and ensure they're okay after 10 weeks, 12 weeks. They want to come back and do another therapy of some sort, right? So you need to have that stickiness in this industry, the wellness industry. It is all about repeated usage. It's not about one-off operation of a knee replacement and that's it. All right. This is customer that's going to be there. Hopefully they live longer and they keep coming back, right?
Yeah.
If they live to 120 years, which most people are going to be living till, we have to keep them coming back. Yeah.
Actually, one of my friend is a patient or a customer of one of a Singapore premier longevity clinic, and I asked him actually about it. I think a few weeks ago, and his feedback was there are too many in the space. So as a patient who may not be in medically
Yeah.
versed, they'll
Yeah.
get confused. Like and
No,
everybody,
awareness is a problem.
yeah,
And in Singapore, there's a lot of restrictions as well. So it has to be a very regional effort. If you want to manage customers from Singapore or Hong Kong, we treat it as a regional effort from Bali, Bangkok, as options for these customers to look at longevity in a more broader way, rather than being restricted to only the rules within Singapore are not allowing a lot of therapies. And so even if you have a longevity clinic in Singapore, I think
mm.
unfortunately the services they have is just like any other normal GP clinic sometimes, like they can only do certain tests
yeah.
and diagnose, and
Mm.
then they have to go through hospital care for any other IV therapies. And even IV therapies, you're not allowed to do a lot of IV therapies, which actually it's really sometimes seen as uh, part of life in some other cities now. Like you go to even in Dubai, nearly everybody gets IV therapy at home.
Yeah.
It's okay, maybe a bit of an extreme, but like you have always got to understand you cannot control what people want or do with their own bodies, and some want to optimize themselves. They want to focus on muscle building. Some want to focus on weight loss. It has to be personalized, and we need to allow innovation to also come in and not restrict everything, right? We have to be safe. We have to look at source of the products, GMP certified. It has to be very well audited facilities. So you cannot get away from the infection kind of safety measures and the quality product safety measures. Because if you don't do that, you will end up getting the ones that are lower quality being smuggled in or
Yeah.
under conditions that are not ideal. Then you get into problems. So the
Yeah.
only things you hear are problems in certain countries where it's too strict, right? Because you get all these unregulated vendors. You got to get good quality products legally done within the countries, and then the safety is there. Uh, Doctor-led, coordinated programs, so that you're looking out for risk factors and complications, and the treatments then are accepted by the customer, whether the customer has benefit outcome. Outcome is everything. If the customer has outcome, then it's a word of mouth and people get to know more about it, and it's a cycle after that. Yeah.
So you covered multiple countries and also regulatory considerations and some of the
Yeah.
risks. How do they how do each countries differ? Okay, before we go there, which market are you most strong in right now? Like which market do you have a most
Are you okay with time? Because you already, I think we have gone about an hour. You're okay with the time? I can keep going, but
Yeah, it's okay, it's okay, it's okay. It's normal. This is normal. Yeah, good. Go ahead.
okay,
Yeah.
okay. Yeah. So, yes, it's very interesting topic about regulations, about the local. I've had this learning curve over the years about multiple countries. We operated in like 8 countries in telemedicine. So I kind of saw regulations evolve
Mm.
and always engage the authorities if you have questions. So I always email out to like Dubai Healthcare Authority if I have questions, and they're very good at replying within 2 days. They have some KPI they have to answer within a certain amount of time.
That's
So
good.
I love to work with countries where the regulations are there, plus there is a response and also persistence, right? You also follow up and ensure they respond. Even India, right? Like certain questions, I would ask my people I know in Delhi, and they will find a response at some point. And I don't know yet about Thailand. So you have to think about local partners who are strong, who
Mm.
can ask those questions for you.
Mm.
If you cannot, ask yourself. In Indonesia, also, we have a
Mm.
very strong local partner,
Mm.
and they will get the answers, right? Kalbe
Mm.
Pharma, for example, does the stem cells there. They started this in 2012 or earlier.
Mm.
So in a way, they have a history of regulatory questions and support, and single line therapy, for example, versus other types of therapies. So yeah, you can ask the right partner to ask the government or MOH, and they will turn and they will evolve. So you need to engage them continuously. There's no such thing as I asked today
Yeah,
and
of course, it will change, right? So I'm just before I want to go into that, but I want to just kind of get a high level view of which markets are you more active in right now? Which countries? And which countries? I mean, you mentioned that you're also going to Bangkok as kind of like a new initiative. So
yeah,
just curious of where you're operating in
yeah.
most. Yeah.
No, the most active is Dubai, India, and Bali.
Okay.
And the Bangkok is the latest that we
Okay.
have just entered with a partner in Bangkok. And uh, I think these are the most progressive places
Mm.
for wellness, and
Yeah.
would love to enter Saudi next. but we will most likely do that. It's a huge market as well for wellness.
So before
And
we go into
yeah,
I want to just kind of touch that. So those countries you mentioned, right? What makes them more favorable compared to, let's say, other countries in the region or outside? Like, do they have a more? And also, you mentioned about the regulation, right? Of course, you don't want regulation to be too strict, but you also don't want the regulation to be too loose, right? So, like, where do you see the differences? Yeah.
well, I think every country is unique in its history of evolving in certain treatments, therapies, doctors around there,
Mm,
acceptance, and so on. So I don't generalize, but
mm,
when it comes to some of these countries are known for something,
yeah.
and we want to use that, what they're known for, hospitality, for example.
Mm,
Uh, Bali, I'm not talking about the whole country of Indonesia. Bali is special.
yeah. True.
Uh, Thailand is special for that as well.
Yes. Yes.
And that's why these are natural places.
Mm,
If I set it up in Malaysia, it may not be a natural place initially, but there is a wider acceptance of medical quality in Malaysia,
yeah.
of all the doctors and the GPs and everything. The ground up, it's a good quality place. But whether I can do a similar thing there right now, maybe not, because of the regulations on stem cells and certain IV therapies and peptides, because you can't get access to them. Even a compound, one of the things I need is a compound pharmacy as a
Yeah.
partner.
Right.
And the compound pharmacy should have the ability to get these done in a GMP facility, in a very well regulated. And in Malaysia, for example, the compound pharmacy openly told us certain things they can't do. They can do certain hormonal things. They can't do certain peptides. They're not allowed to do injectable peptides.
Mm.
So there are differences in every country, and we need to first take it separately and then work on it, incremental process to work on that. Yeah.
Of course, depending on different therapies, also different compounds used, right?
Yeah.
Regulation will differ by country by country. So, of course,
Yes.
when we say which countries are more better or not, that's a very high level view, right?
It's
Uh,
not better. I would never
yeah.
say
No,
better.
no,
It
of course,
is
of
just,
course.
yeah,
Easier. Yeah. Of course, that's kind of like a very
more
general.
ready. I would say more ready.
Yeah,
They are
more ready.
whether they're ready or not ready, and the steps to
Yes.
get ready, right?
So
Yeah.
yeah, so I think yeah, I mean, if you actually look at it more deeply, then yeah, we start looking at different therapies, IV therapy, stem cell, IVF. I mean, and also what kind of compounds they use. Then every country will differ, right? So I think yeah, I mean, it's this is an insight that it will be hard to just kind of cover over like one or two topics.
Yeah.
Uh, but you do have that kind of insight with your
Yeah.
current platform, right? You do
And
have
and
that.
again, it's not rocket science. Like, I don't need to be the only one learning and keeping all of it in my head, right? I work with partners.
Hmm.
Partners have to have this local knowledge of every country. The
Hmm.
compound pharmacies will know, the labs will know, the doctors there would know. So you have these three kind of people around you in every country that's will continuously give you feedback, and that's the way to go cross border, right? You learn from different groups. Yeah,
So you have this kind of insight that you can share. Uh, so let's say because I do come across a lot of these biohacking individuals
yeah,
nowadays. Some of them are more serious, some of them are not. But these people they do some crazy research, but it's very sporadic, right? Information is kind of a sporadic. Is there anybody in the space who kind of has compiled all this, like kind of like a market intelligence insights that people can just access and I mean, I guess that's what your platform is kind of doing.
oh, they're the public ones, those that are openly promoting these. They will
Hmm.
say what they have done, and unfortunately, not everyone has all the facilities, not all the modalities in one facility, right? Ended up many of them only have a few modalities and say, "Oh, this is good," or "No, that is good," right? Uh, when it comes to a hospital, like you have OT, you have radiology, you have certain treatments, scopes. You have a fixed structure of
Mm,
a. At the moment, what we have done is actually to come up with a fixed structure to a wellness center.
mm,
So in the one in Dubai that we work with, like we have all this equipment, but we know each room what is there, 80 different therapy opportunities inside. And those 80 different rooms or treatment modalities is what we are learning from and saying, okay, these 10 at least should be there, base 10 that we need to have in every place. Then that acceptance of a facility with a certain number of therapies as a minimum, right? Then you can have like secondary, tertiary wellness facilities, right? Where
mm.
you know that you can standardize and grow. So it will happen. It's a natural thing that people will say, "Oh, you don't have a hyperbaric chamber? I won't come there," right? Or you don't have a colon a hydrotherapy? Uh, That's what I'm there for. Or so you have about 10 things that you must have that to enter. And so when resort comes to me as well, like there are a lot of places where resorts like Sri Lanka, Maldives, they want to get into this. I'll advise them, this is what we need, this kind of structure. It's like, I'm not
Oh,
franchising this yet,
uh, I'm
but
not. I'm
you
new to
know,
this as well. What are some of the 10 basic things you need to like the wellness, I guess, the facility you should have?
yeah, as I said, like, if you just rattle off like hyperbaric chamber, hot
Okay.
cold, red light therapy,
Mm,
sauna,
mm,
the IV therapy with a compound pharmacy partnership,
mm.
these are the basic stuff. And then you can choose Ayurveda, TCM, whichever is additional function for functional medicine. You want to mix a few things that people are open to, and you don't want to be restrictive, but at the same time, you it depends on the phase of your the stage of your growth,
Mm.
how many new services you want to add, right? And the doctors you have also, right? The doctors may know only a few things, or they want to be open to more things. So depends on who you have with the practice. So then only they can be convincing to the customers. If not, you can't convince the customers, and the service will not be used. All right. So yeah,
Yeah, this is good. I think this is probably the most in-depth discussion I had on the longevity, the wellness. Like my focus more in the medical device, biotech
yeah,
stuff. So, but this is actually good that there's all these different kind of therapies, and now it seems like
yeah,
the industry is also kind of becoming a little more standardized, right? And also there's a movement by different governments with I guess maybe relaxing the regulation or make it have a more quality control. So I think this is a good thing that I see moving forward. Yeah. I
excellent.
think
Yeah.
toward the end of the time, maybe if you wanna give some kind of like a final takeaway on where you think this will move, like the where you see there is a potential for the
Yeah.
industry, and
I feel
yeah.
again, it's a very early days, so it's like 2012 all over again for me when it comes to telemedicine. And so the next 10 years is going to be the most exciting. And there's
uh,
quite a large project I'm working on in Bali.
mm,
And that one, once it's done, it becomes a real like longevity hub for the whole region. That's something I'm looking forward to. And if we can, probably showcase that once we announce it
yeah, that'd be nice.
in
Yeah.
the next 3 months, we should
Oh
be
wow. Okay.
announcing it, and that would be really exciting uh, for Bali as well. Yeah, like yeah, but we are open to doing more collaborations because that's the only way we can grow
Mm,
and learn. And if this industry has to grow, we cannot be like in a cocoon. And hopefully the clinics in Singapore, we have our own clinic in Singapore as well, in Scotts Road, called Ardmore Clinic, and we are open to doing more and more for longevity within Singapore, and hopefully it's a regional thing, and it's not going to be just each country doing its own thing. Yeah.
Hey, thank you. So I think we're at the end of the time. So I want to thank you again
Yeah.
for taking your time to share your, I guess,
No,
insights.
no.
Uh,
Nice to talk to you always.
no,
And
yeah, likewise, likewise.
you have
Uh,
been doing a very original thing. I like one thing about you is you're so original as well. Like you're in love to meet up again, maybe in Bangkok when you're there, or
yeah, yeah, yeah.
yeah.
I will share with you some of the events. I'm actually doing an event in Bangkok next month.
Okay.
But of course,
I may
maybe
come.
when you're
Yeah,
in town,
yeah,
I'd love to invite you as a speaker. I also want to do some, kind of like what we did today. I want to kind of have a kind of a cross-border dialogue. I mean,
sure.
I do different topics also, but with you, I think medical tourism, wellness. I think there'll be a very interesting discussion. So, yeah,
Excellent.
would love to, I guess, invite you again for that. Yeah.
Yeah. Looking forward to that. Thank you so much.
Hey, thank you. And of course,
Yeah.
I want to finally thank our audience
Yes.
for taking their time to watch this. So thank you.
See you.
Okay,
Take
take
care.
care.
Bye-bye.
Bye.